I have the great pleasure of being joined right now by APHA President-Elect Dr. Camara Jones. Thank you so much for being here.
I'm delighted.
You have a Herculean task ahead and dealing with so many important topics in health inequities. So let's talk about the theme of this meeting. It's health in all policies.
Right.
So how does public health really work together to improve social justice and some of those health inequalities?
Well, the first thing is to recognize, and we all recognize in public health, that health is not created within the health sector. It's not created in clinical medicine. It's not created even in our public health efforts. It's created by the conditions of our lives. So that includes, education, the criminal justice system, housing, jobs, whether you have a job or not, transportation, agriculture, on and on and on. So that's the health in all policies thing. But what we see is that even the distribution of those goods, those social determinants of health, that's the lingo these days, these conditions in which people are either, they keep healthy or they get sick, those conditions are not evenly distributed. So in my presidency, I actually want to have APHA lead a national conversation and actually a national campaign against racism and other systems of structured inequity.
And there are so many challenges, yet there have been great successes as well. Can you talk about those?
So the successes in terms of equity is when people look at decision-making processes. It's when people look at who's at the table and who's not when you're trying to make an important decision. So often all of us who are here at this meeting are probably decision makers at some level. And we aren't in the practice of getting to a decision-making table and then looking around and saying, who is not here at this table, who has an interest in this proceeding? I want us to get accustomed to seeing the absence of who's not at the table. And then we don't want to just represent them, but we want to find them a way to the table. What's not on the agenda? We need to be addressing inaction in the face of need.
And bringing people together, I think, really is the key to that success. You mentioned the criminal justice system.
I did.
How do the inequities there really impact public health?
When we're trying to do population health and criminal justice, what we see is that even the way that our criminal justice system is applied is not fair. Really not valuing all of our people equally is shunting us into different conditions.
And that's what you have to do, make the changes, bring people together, improve health for everyone. You've got a big job ahead.
Thank you so much. And I actually, in my presidency, would like to mention, as I said, I will be launching the American Public Health Association and as many other national organizations as want to join us on a national campaign against racism, where we define racism as a system of structuring opportunity and assigning value based on so-called race, based on the social interpretation of how we look, that unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, and saps the strength of the whole society through the waste of human resources. And I feel so supported by the membership of APHA, so supported by the APHA, our staff and the like, and I know that this is going to be a fantastic year for us to raise this important conversation for the nation.
And it is such an important topic. Thank you so much. I wish
Thank you
great
very
success.
much. Thank you so much.